Hi everyone, this is Susie Mullins with the West Virginia Collegiate Recovery Network, and we want to congratulate the West Virginia Drug Intervention Institute on their grand opening downtown in Charleston and say how thrilled we are to have them as partners as we address prevention efforts and increasing naloxone access on campus around West Virginia. Congratulations.
Congratulations to Murphy Media. My good friend Murphy, what's up, brother? I would like to congratulate him and give him a word of encouragement and a word of acknowledgement that I've worked with Murphy before and he's an outstanding person. I love it down there. Hope to see you all soon. Aloha.
Congratulations, West Virginia DII and Murphy Media. I'm excited for your partnership and I'm excited for our community because I know you're going to have such a positive impact. Congratulations.
Hello, I'm Tawny Bryant of the West Virginia Department of Health and Human Resources, Bureau for Behavioral Health. I would like to congratulate Dr. Susan Bissett and her team at the West Virginia Drug Intervention Institute on the grand opening of their new location. Congratulations, Susan, and keep doing the great work that you're doing.
Hey, it's Margaret O'Neill with the United Way of Central West Virginia, sending big congratulations to Dr. Susan Bissett and the West Virginia Drug Intervention Institute. Grand opening of their Capitol Street office. So excited to have you in downtown Charleston. Congratulations.
My name is Dr. Norman Montalto. As an academic family medicine provider with managed care and population health experience, caring for Medicaid patients using a holistic approach is exciting. This strategy is powered by preventive approaches, educational initiatives, collaborative partnerships, advocacy, and research occurs. In addition, critically important educational services, advocacy components, and outreach will help address and reduce the social determinants of health that impact these individuals and families most directly. Congratulations on your opening.
Today's a great day. The ribbon cutting for the West Virginia Drug Intervention Institute and Murphy Media, announcing a new building and a new partnership. It's partnerships and collaboration that will really allow us as a state to address the opioid epidemic. So today's an exciting day because this is an announcement of a great partnership, and through the leadership of these two fine companies, more and more collaborations will be made and strengthened as we all work together to address this major problem in our state. Congratulations to West Virginia Drug Intervention Institute and Murphy Media. Thank you.
Hello, I'm Rebecca Linger, a professor at the University of Charleston School of Pharmacy, and I want to wish the West Virginia Drug Intervention Institute and Murphy Media a very welcome first year. It's been a tremendous experience working with you guys, and I hope to have many more collaborations to come.
Hey Susan, it's Ben Beeks with 3 Point Strategies. Hey, congratulations on your virtual ribbon cutting today and the work that your organization is doing to educate our community, families, children about medication safety. Your work is very important and we're happy to be a small part of that. So congratulations on your virtual ribbon cutting.
Hi, my name is Lindsay Akery. I'm a pharmacist with the University of Charleston School of Pharmacy, and I'm really excited to be here today to celebrate the partnership between DII and Murphy Media. They've really worked well together for years, but now they are downtown in one location, so you can work with both of them at the same time, which is great. And I'm sorry that I could not be there during the actual ribbon cutting, but I have my ribbon and I have my scissors, and so congratulations.
To Murphy Media and the West Virginia Drug Intervention Institute, congratulations on today's ribbon cutting. We know all the effort has gone into this project, and it's exciting to see it come together this way. We've had the pleasure of working with Murphy Media for the past few years, and we're excited to see what comes from this new venture. The DII is such an important organization, and we think Murphy Media will make a great partner with them in the mission to reduce overdose deaths in West Virginia. Congratulations again.
Congratulations, Susan, on all the great work that you and the staff do at the West Virginia Drug Intervention Institute. And congratulations on your new move downtown to your new headquarters. I've been delighted to watch the progress that you've made these past several months, and I look forward to all the great things that I know you'll be doing in the future.
Congratulations, West Virginia DII and Murphy Media, two outstanding companies partnering for some of the most wonderful causes. Congratulations. I'm proud to be a part of your virtual ribbon cutting.
My name is Patrick Morrissey, your Attorney General. I wanted to congratulate the Intervention Institute for its good work and for its virtual ribbon cutting today. We're in different times, so we have to talk a lot more online and virtually, but I'm very pleased with the work you're doing. For us to all be able to tackle the opioid epidemic, we need a large team. We need a lot of people taking dramatic action to stop the senseless death in our state, and I'm pleased that you're joining this effort. Thank you for everything you're doing.
I am Steve Williams. I've been seeing everybody cutting silver ribbons. I am so proud of Murphy Media. We've got one gold ribbon to be able to cut for Murphy Media. Joe, we're awfully proud of you.
Well, I'd like to say congratulations to the West Virginia Drug Intervention Institute, their grand opening of their office in downtown Charleston. But I'd really like to thank them for all the efforts that they're making and will make in the future for education, for prevention, for advocacy, for collaboration. We've got a real problem in our state and really across the nation, and I really admire the efforts of the West Virginia Drug Intervention Institute to try to put together solutions, to try to meet the problem where it is, and to help families and folks all around the state to try to get well, to meet the challenges of addiction, and to find out where those resources are. So good luck and congratulations on your grand opening.
Hello, I'm Senator Joe Manchin. It is a pleasure to be able to send you virtual greetings today as we celebrate the partnership of Murphy Media, Inc. and the WV Drug Intervention Institute, Inc. These entities work closely together to combat the opiate and substance abuse epidemic in West Virginia and reduce the overdose deaths in our state. West Virginia knows all too well the devastating effects of opiate and drug abuse on individuals, families, and communities. Last year alone, we lost over 70,000 people due to drug overdose. That's more than the number of people that we lost during the entire Vietnam War. Since 1999, more than 700,000 people died in the United States from drug overdoses, primarily related to prescription opiates. This epidemic is having a lasting effect on our families and communities. We have a responsibility, all of us, to step up and do everything that we can to combat this epidemic. As this drug misuse and abuse continues, more kids are being raised by grandparents and in foster care than ever. More babies are born with neonatal abstinence syndrome. If we're going to have a fighting chance to break the multi-generational cycle of addiction, prevention needs to start with our children and youth. I know that continuing to work together, we'll be able to fight this epidemic and have an impact on countless families in our home state. So thank you so much for all your hard work, and God bless each and every one of you.
Celebrating today the partnership between Murphy Media and WVDII in this amazing new location that we have here in Charleston. Here's Dr. Susan. Dr. Susan, would you like to say something to everybody before we get started?
Hello, thank you for joining us. We're really excited you all are joining us virtually. It's kind of a new world, but this is the way we're connecting. So super excited for those of you that tuned in.
Yeah, and there you have it.
Welcome to 118 Capitol Street and the official unveiling of the West Virginia Drug Intervention Institute. We are a nonprofit organization that works every day to reduce overdose deaths in West Virginia. And today we're celebrating our presence in the capital city of Charleston. We're celebrating our mission and our purpose, and we're celebrating our partnerships, including one very special partnership with Murphy Media.
We're here today to really announce and tell a bit of the story about the West Virginia Drug Intervention Institute. And it's really an amazing story already. And it's been successful because we have a strong board of people who are interested in the community and involved throughout West Virginia. We have the outstanding leadership of Dr. Bissett and her team, and we're pleased to have that. Joe Murphy has stepped up and used his talent to take the vision of Rex and make it real so that we can take it around the state in person and also visually. We have a special relationship with the University of Charleston. It was our first home. Dr. Marty Roth, the president, is a member of the board and supportive of what we do. And we're happy to work with the faculty and the administration and students there in delivering our programs and in reaching out for grant opportunities. We're happy also to be a partner to the city of Charleston. We know well Mayor Goodwin's concern about substance use disorder and about the opioid challenges confronting West Virginia and Charleston. And we're glad to be her right arm in addressing those challenges. We have support from many quarters. We have funding and support from the Mayor Foundation, from Aetna. We have also a special relationship that is developed with Ruth Pharmacies, and also funding from the Capito Fund at the Greater Kanawha Valley Foundation. But all of this would not have been possible without the vision of Kelly King, who was the chair and CEO of BB&T and now the chair and CEO of Truist Bank. He wanted to reduce drug deaths in West Virginia and reached out and gave us the opportunity to develop the Institute. BB&T Truist, through their corporate giving and charitable contributions, are the major sponsor for the Institute. And we're very grateful to BB&T Truist and also to the leadership of the bank and to their charitable contributions unit. Representing them is Bobby Blakely, who will receive the microphone next. He is the regional president for BB&T Truist and is also a member of the Institute board.
Right. Well, thank you very much. What do you do when someone or something very important to you is in trouble? You lend a hand. And that's what our chairman and CEO did in 2018. He just read an article in the New York Times that talked about the opioid epidemic facing America, and in particular West Virginia. And this state is very important to our bank and our corporation. In May, he was visiting our region and discussing how things are going in the state, and he said, I just read this article. There has to be something that we can do to help. And I said, well, that's a big question. I'll take it on, but let me try to figure it out. He suggested, and about a month later, I found out he was very serious about his offer to help by offering to fund an assistance, some type of assistance. He asked if I would enlist the help of Dr. Welch, Holmes Morrison, our former CEO and president of One Valley Bank, and the late Nell Chilton, to come together and come up with ways that we as a corporation might help with this issue. The more we learned, the more we realized we didn't know. We realized how enormous the issue was. It's multi-pronged and multifaceted. And where in the world do you begin? Well, what we did, we read about it a lot, we shared articles, we read Dreamland, we read books, we went to movie screenings here in Charleston, we attended lectures, shared anything and everything going on, and a remarkable group of people. But we decided we needed more opinions than just our own, just our very novice opinions. So we put together a roundtable discussion. Everybody that we solicited help from, without exception, cleared their calendars and attended. We had the head of the DHHR, the head of CAMC, the head of Brick Street, we had the head of the United Way, we had our friends in Huntington who have battled the issue directly. We had the leader of Recovery Point attend, the CEO of Highland Hospital attended. It was an amazing group, as well as a mother who had faced this issue very personally in her family. And we sought to ask lots of questions, like how in the world can we help? And so after about 2.5 hours of great open discussion, we took a poll, and without exception, everyone said prevention was really an area that we might make a difference. Our goal was not to duplicate, it was not to triplicate anything that's being done in the state. It's not to go out and fund research and write papers. It's to share research that we find. It's to share best practices of what has worked in other parts of the state, other parts of the world, and address the issue. It might be to fund new programs, or it might be to support programs that need help. But once we had the opinion of our town hall meeting, we decided that it was best to really go to the root of the problem and create the West Virginia Drug Intervention Institute. And we had a great interview process. Dr. Bissett was the right woman for the job. She's done a fantastic job. And so proud that nearly 2 years later, we stand here today really to reduce opioid deaths in West Virginia and drug abuse by being an independent advocate for life-enhancing drug policies and practices, to be a hub for coordinating drug response activities, and to be an educational center to address the prevalence of drug abuse and the stigma of drug addiction. To fulfill our mission, we carry out these activities with 5 objectives. I hope I'm not stepping on your feet. But it's through education, it's through research, it's through collaboration, it's through advocacy, and finally through prevention. We're extremely proud of our association. $750,000 has already been given, but that's just a drop in the bucket to the issue. We realize we need to do more. And in the coming weeks, we hope to be announcing even much more significant support, and stay tuned for that. We're excited about that. We're really proud, Dr. Bissett, of what you and your team are doing. You all are making a difference. Our purpose as Truist Corporation is to inspire and build better lives and better communities. And truly, partnering with you, partnering with the city, partnering with Murphy Media to make this happen is making and inspiring better lives and communities. And we couldn't be more proud of that association. So thank you for what you're doing. And we are very, very proud.
Thank you to everyone who's watching and everyone who is here. Mr. President, it is always wonderful to see you, and thank you for your commitment, and thank you to Truist as well for their commitment. To say that you all have the dream team is about the understatement of the year. I've known Joe Murphy for a very long period of time, and his creative talents will serve so many families. Dr. Bissett, not only do I have a great friendship with her, but something that I definitely know in the work that the West Virginia Drug Institute does in partnership with the city is you have to have 2 things to make this work, and it's somebody who uses their head and their heart. You can't have either, or you have to have both. And that's what you bring to this institute. And so thank you always. For the families just like mine, who 4 years ago, next week, buried a 29-year-old who died of a fatal overdose. A beautiful kid in his 20s. WVU, engineering student, had everything going for him. My family is like every other family that are going through this, and that's the mission. The mission is not to bury another Michael, is to make sure that we're out there with prevention and that we're working together, and from a city standpoint, sharing the data that needs to be shared, because it's something that I'm not sure that we did a great job in the past of sharing that data that can really make a difference. I'm just thrilled to be here today with Murphy Media and Rex and Dr. Bissett, and with the leadership here from both of you. So thanks for establishing right here in the heart of downtown Charleston. We're thrilled to have you, and our families are thankful that you're here. Thank you.
So I've written down my remarks because I was afraid that I might forget something, because I have a lot of partnerships to mention. But since May of 2019, when I started my time as president of the Institute, just want to share some of the things that we've been able to do. We have reached about 40,000 families about the importance of medication safety. We have distributed over 5,000 medication disposal kits. And what that means is that potentially we've had 225,000 pills out of homes where they are likely to be shared, abused, or diverted. We've also educated over 5,000 students in West Virginia about medication safety in 5 West Virginia counties. So just in the short time that we've been here, we've been able to really make that kind of an impact. This has been accomplished through the guidance and leadership of our board, and also through the very hard work of our staff. And so I want to take a moment just to introduce our staff. They're often behind the scenes. And so Charlie Fox, over here, who is manning the microphone, is our assessment and research director. Charlie works very closely with the city and does a fabulous job with research. She is also the legal expert in the building because she is a lawyer, and so I often go to her when it comes to, does this sound right for a policy? What do you think? Jessica Napier-Eagle, who is our education director, who has been pretty much every school in Putnam and Kanawha County in the last year and is working to educate teachers. And then Tanita McCourt, who is our program director, who is moonlighting as Rex today. So I wanted to make sure that we introduced our staff because they really do a lot of work. They work a lot of overtime. They work weekends, they work evenings. They email me at 11 o'clock. I email them at 11 o'clock and they actually answer back, which is not expected but appreciated. We've also had the opportunity to establish partnerships. We've already talked about the mayor's office and our coordinated addiction response effort, but we also work very closely with the City of Charleston Police and Fire Departments and the quick response team in Charleston. We also have the partnership with Fruth Pharmacy that Dr. Welch mentioned. We have a partnership with First Choice Services, which manages the Help for WV, and Synergy Health, whose CEO is in the room today. Thank you, Eric, for attending. The Kanawha Valley Collective, the United Way of Central West Virginia, the University of Charleston, specifically their School of Pharmacy. We had 90 pharmacy students engaged in our programming last year. They were in schools with us, and so that's remarkable because some of them received nothing and some of them received a small stipend. So we're very, very proud of that work. The West Virginia Office of Drug Control Policy, I know Bob Hansen is watching today, Solutions-Oriented Addiction Response, and Joe Solomon, the Charleston Area Medical Center, the West Virginia Department of Education, and the West Virginia Prevention First Network. So now's the hard part because we've been grouching at each other all morning, so I have to find something nice to say. No, these partnerships have obviously been very invaluable to reducing fatal and non-fatal overdoses in West Virginia and spreading the word about medication safety, but also increasing access to treatment services for those that are impacted by substance use disorder. But one of our most valuable partnerships has been with Joe Murphy, CEO of Murphy Media. And I know that Steve Williams, the mayor of Huntington, is watching, and he's not particularly happy that Joe Murphy is in Charleston. So I will say that this is one of 2 offices that Joe has now, so he does have an office in Huntington. But when we moved downtown, we were very fortunate to be able to have Joe come into the space and work with us side by side, and that has been invaluable in terms of some of the things we've been able to do. Many of you know the story about how Joe and I met. I called him on a random Thursday afternoon and said, I have this crazy idea about this talking pill bottle. Here he is. He's not talking today. But Joe had a lot of sage advice about how to do that without endangering children, but educating children and helping them to understand that medication was not something to be shared or messed with. It was something to be respected, stored correctly, and disposed of correctly. And we just keep doing more. Now we're looking at virtual reality possibilities for Rex to help kids engage while they're at home isolated because of COVID. So the possibilities are endless. He has become one of my dearest friends in addition to my colleague. And yes, we do fight from time to time. It's a 50-50 chance who's going to win. So sometimes the staff tosses a coin. But we're very, very lucky to have him here in Charleston as well, and that's just an added benefit. And he is our primary media partner, and so with that, Joe Murphy. Do you want to wipe it off? We work together, so.
I've never been called a man of few words, but today I'm going to be, because Dr. Susan put it so well. It has been a great blessing for me to partner with this team, for Truist and BB&T to see value in our vision. Really being able to use innovation and creative ideas to tackle this problem is the only way we're going to tackle it. And to be able to be given the opportunity to do that means everything to me. I decided in this past year that Murphy Media is no longer about anything but stopping the opioid deaths in West Virginia. So we have no private sector clients. We are focused on this, and we believe that with the help of the WVDII and all of the organizations that are working towards this, we can get there. We do believe that West Virginia is the epicenter of the cure, is the epicenter of the answer, and we intend to show it with things like virtual reality and using innovation to engage children and adults, because we believe it's all about education and teaching folks the dangers. One of the most important things that I want everyone to know and believe is what I believe, and that is we're all one back break, mental break, or heartbreak away from being in a recovery center ourselves. So we're not that far apart. So one of the things that we intend to do is to reduce the stigma, which reduces barriers to treatment. So, and that is what this place is all about. We have a museum, we have interactive exhibits, and we have a place where you can go one or two at a time and learn about medication safety and get a little education. So again, I am blessed that you guys saw value in this vision, and I'm blessed to have such a partner as Dr. Susan. I'm blessed now to have an additional mayor that supports what we do, and I thank each of you for coming and for supporting us.
It's a group effort.
I'm not allowed to touch
I'll hold
the
the ribbon. Joe's not allowed to touch these alone.
This is the only time I've been able.
Here, I'll hold the ribbon. Susan, you got it. You're right. Put your hand on the ribbon. 3, 2, 1.